The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone. Welcome to the AVPN webinar on making innovative finance practicable in India. This is the first webinar in a series of 3 webinars that we'll be doing on this topic. My name is Kavita and I'm the Manager, Knowledge and Member Engagement at the Asian Venture Philanthropy Network, AVPN India. AVPN is a unique funders network committed to building a high-impact philanthropy and social investment community across Asia. Currently, we have over 600 plus members across 59 countries, and we are very pleased to have 2 of our members who will be speaking today. Representing KOIS, we have Dr. Prabhu Tirupati, Principal, and Serena Guarnes-Kelly, Partner, KOIS. Both Prabhu and Serena will enlighten us on what innovative finance is and how we can practice it in the various funding opportunities in the social sector. Before we proceed, a few housekeeping instructions. We will not take any questions during the presentation, but we'll have dedicated Q&A sessions. So you'll see on the screen when the Q&A sessions start. So please feel free to type in your questions from the console while the presentations are going on. And once I see the questions from you in the Q&A sessions, I'll be raising those questions to the respective speakers. We will also be having a Q&A session at the end of all the presentation. If you have further questions that are not answered by the end of the webinar, you can email us at india@avpn.asia. With great enthusiasm, I'll now hand over the presentation to Prabhu.
Hi everyone. Good afternoon from Mumbai. Serena is going to be joining from London, so I thought I'll give a quick brief of myself before handing over to her. Some of you, I think, are partners with us, but for the rest of you, I'll give a firm intro as well as my personal intro. So as COIS, we have a hybrid model where we work across 2 big areas, innovative finance and asset management. With funds across India and Europe, more on the impact investing space. And I work with our team more on the healthcare area, but also some allied sectors, including sanitation. And we have investments in the health space across India through 2 of our funds, but also in some in Europe and the US, where we see the confluence between impact and, say, financial returns. More for today's discussion in the area of blended finance, I've been working with Serena, helping development aid agencies, but also foundations and the private sector look at their blended finance strategy, but also structure and place some of those instruments across both of these geographies. As a quick personal intro, I was a medical doctor, spent about 2 years across India's public and private space, and then spent a bit of time in strategy consulting with McKinsey before moving on to COIS. On to you, Serena.
Thank you, Prabhu. Good morning from London and good afternoon, everyone. I'm a partner at COIS, as I said, based in London, where I oversee all of our advisory work, which focuses on innovating finance and blended finance. Some of the terms that we'll discuss today. My background is strategy consulting for over 15 years, first with McKinsey and then development consulting, where I've helped foundations and donors in the space of innovating finance. For example, I supported the Bill and Melinda Gates Foundation with their strategy for innovating finance as a way to partner with existing and new donors. And also work with investors and development banks on defining, for example, their strategy in emerging markets across a number of sectors. Since I joined COIS, I've been focused on innovating finance products, including impact bonds. I was part of the team that helped design and fundraise for the humanitarian impact bond with the ICRC. We'll talk about later today. And also previous to COIS, I was part of the team that designed and launched Convergence, that some of you may know, and we may briefly mention today, which is an online blended platform that I launched in 2016, where I also acted as the interim investment director during the first year of its operations. Over to you, Prabhu, to set the agenda for today.
Thank you. Sorry, I'm just not able to move the screen. So I'm just going to start speaking through the objectives while we move the slide as well. We wanted to, like Kavita mentioned, this part of a multi-series. And with the first session, we essentially wanted to ground it in a lot of the basics of innovative finance and just building the vocabulary so that we could have much more nuanced sessions as we go forward. I think the other objective also is to keep it more of a discussion. And like Kavita mentioned, we will be taking questions at the end, but feel free to say type them out all through the session so that we could like pick and discuss those at the end of the session. Quickly going on, we had 4 objectives for today, and all of this in terms of grounding this entire topic in India, but also globally, which was just introducing that vocabulary for such a nascent field. And there have been multiple attempts to frame innovative and blended finance over the years, some of which Serena is going to regale us with, but essentially also describing how they are both related. I just wanted to take a quick moment to also speak about the vocabulary, which some would also call jargon. And that's a common, say, complaint we've heard from, say, development partners, but also others as to what is really innovative finance, or is it just an all-encompassing word that is more jargon than vocabulary? So we really wanted to take the time out to discuss that. I think that's quite important, given my past time in the medical field as well, where for, say, someone looking at this field, there could be quite a bit of a difference between someone who spent years versus someone who hasn't. So that essentially is our first aim with today's session. The second was say, discuss what or why do you really need to do innovative finance. So there's quite a bit of buzz around it, and a lot of us want to do it, but we also wanted to discuss why should you do it, and the questions around what does it bring to the table. And there are really 2 key applications that we see that we wanted to discuss later. And the third big objective we wanted to clear was provide you a menu of the different options available so that you could start off with a superset and really figure out what works, what doesn't work, and go in a like step-by-step process. And the fourth was also, I think, going to be quite crucial. Just like let some of these myths and perceptions that do bubble to the top from you and also from what we have heard through our work, and address some of these, but also reinforce some of the real and actual challenges. So essentially just creating the difference between reality and perception and helping inform some of that from our work as well. So those were essentially the 4 parts to this. And I also wanted to say that given this is a relatively new field, I guess I can say we are all learning as we go through this journey. So some of this may maybe things that we as well are developing our like mental models around. So feel free to ask your questions and table some of your perceptions as well, so that we pick it up as we go. I now wanted to say hand over to Serena so that she could pick up some of the earlier definitions and the vocabulary.
Thanks, Prabhu. And as you said, let's start with the language or the jargon. And I think it's important to ground the language into some of the history of the terms and ultimately the reasons why they were coined. So let's start with the older one of the 2, which is innovating finance. This term has been around for a while, at least in development history. It was first mentioned at the International Conference on Financing for Development in 2002, which was also known as the Monterey Consensus. And back then, all the governments recognized that there were there was a lot of discussion around what the Millennium Development Goals, as they were called back then, and realizing there were huge gaps in funding. And it was done as a way to try to rally governments to do more, particularly with their own contributions of official development assistance, both committing to a percentage of their funding to development, as well as better coordinating and pooling that funding. And so this was the first time where the term innovating finance was acknowledged, and it was done with much of an emphasis about recognizing the value of exploring innovative sources of finance, provided that those sources do not unduly burden developing countries. So again, a lot of the focus was around sources of funding rather than the uses of the funds. And then very quickly became a broader term that looked at ways to bring more money. So a lot of the emphasis was on the absolute amount of money that was used towards development. And then some initiative also looking at how to deploy the existing money more efficiently and more effectively using public resources. So both more money as well as more impact for the same amount of money. What happened following Monterey is that, particularly with the help of some large foundations like Gates and some governments like the UK and the US, it brought a lot of momentum into development finance and particularly aid to coordinate and pool public resources. And so this is where in history we've seen the emergence of some well-known initiatives now, like the Global Fund for malaria and TB, Gavi, the Global Alliance for Vaccine and Immunization, and there was also a rise in, again, the focus was on public sources, on mandatory and voluntary taxes that also were contributed, for example, to UNITAID, to the cause aids. What happened though is that following the success of, I think a lot of momentum was around healthcare, there was a bit of a struggle to replicate the same momentum around the healthcare in a similarly coordinated way. And at the same time, there was a realization that the focus on sources of money, and particularly public sources, was missing a huge opportunity to actually look at truly new capital into the space, particularly private capital, to help reach the, in this case, the Sustainable Development Goals, which is the new version of the Millennium Development Goals. And that's when blended finance was born, so to speak. I actually remember the moment, it was in 2014, 2015. I was working with the World Economic Forum and OECD, trying to prepare for an international conference on financial development, and realizing, particularly the World Economic Forum, about the need to be a new framing to start engaging corporates and investors around the space, like innovating finance, that was primarily led by governments and public donors. And so that's when we realized that we needed to reframe the solutions. So it was, again, a lot about the language, but also about the intention, about shifting towards tapping the potential of private money within the larger space of innovating finance. So the way there were a lot of definitions floating around. The way we tried to consolidate and define blended finance was to focus on, again, the use of public and philanthropic resources, but in a more strategic way. So not just on a grant basis or towards programmatic, but more with an intent to mobilize new private capital for towards development outcomes. This term was first used in 2015. So again, fast forward, it's about 15 years after Innovating Finance was coined. And it was launched as part of the Addis Ababa agenda, where we also launched, back then I was also working with the Canadian government and the World Economic Forum on Convergence, that some of you may know, as a blended finance online platform to try and help support the momentum around blended finance. Maybe beyond the history, I wanted to move to numbers, sort of like to put things in perspective. How big is this market? Just to explain what the buzz is around this market. So on this page, you see our first attempt to actually size the innovating finance market. So this was done about 2014. It was a study that I did with some funding from the City Foundation and the French Development Agency. And it was the very first time that we tried to size the market. So again, it's about 10 years after it was first coined. There were some reports out there, like the World Bank, trying to define what's innovating finance and what is not. And there were some reports that were trying to size the market, particularly in healthcare, but nobody had tried to put a number around the market. And so in order to do this, we had to narrow a little bit the research. And as I said, look at both sources and uses, but focusing and narrowing down our definition to how public money was sourced or put to use to catalyze some private money, but focuses on the public side. So in terms of, and we were trying to capture more of the trends, and as you can see, this chart tells us a couple of things. The first one is that following the Monterey Consensus in 2002, there was a momentum in innovating finance. This was probably a lot of capturing some of what was the political momentum about global healthcare. But as you can see, it also tracks the rise of more privately led efforts or private-based mechanism, market-based mechanisms such as microfinance, and also impact investing. The second key takeaway from this research was that it again started debunking some of the myths around this language, is that innovating finance is not financial innovation. As you can see from the chart, the vast majority of innovating finance transactions are fairly simple, I would say non-innovative mechanisms like guarantees, bonds, investment funds, things that have existed outside of the development space for decades. And so what was innovative more than the instrument itself was the application of the instrument to new markets and new sectors. And then at the margin, there was some financial innovations such as impact bonds or advanced market commitments or the IFIM the notes issued by Gavi towards vaccinations. But this, in spite of their excitement around these new instruments, they were very, very hard to replicate and scale. So again, then going back to a shift from public towards looking at sources that have more emphasis on catalyzing private capital, we looked at blended finance, and this is basically I handed over my database to Convergence, took its own life, and they had a broader definition in terms of trying to also capture private capital flows into some of the innovating financing mechanisms. And as a result, they were able to capture some of the larger transactions that are happening in this space. This chart is slightly different, also shows cumulative capital committed, which means funds that have, for example, used a donor as a guarantee, but then that have evolved and grown into larger funds. So this is more inclusive, and it also shows how this has grown over time. And again, the trend is pretty similar, similar story to what we are discussing in Innovating Finance. It's positive trends, it's growing, but when you break it down by instrument, simpler transactions such as guarantees and concessional capital, for example, concessional debt, trying to attract new investors into a fund, tend still to be the majority of the market size. And in spite of the good news, where approximately 140 billion in capital have been deployed to date towards sustainable development goals, 140 billion seems big, but not when you put it in perspective, unfortunately, of the gaps that remain in achieving the SDGs. This is one of the many estimates out there. This is from UNCTAD, but there are other UN estimates that pretty much tell a similar story, where the gaps to actually achieve the SDGs amount to over $3 trillion annually. So again, the great success story of blended finance, 140 billion. It's not a drop in the ocean, it's a little bit more than that, but certainly calls again for action and for more instruments and better instruments to help bridge this financing gap. Over to you, Prabhu.
Thank you. So, like Serena mentioned, it is definitely not a drop in the ocean. And there have been multiple stakeholders who've been attempting to bring more blended finance instruments. So we really wanted to take you through the journey of how do we even think about what should I do with blended finance. So typically we see three phases within this. One is essentially more of an introspective question of why do we as an organization want to do blended finance? And then secondly, if that's the case, should we do blended finance, which is a more of a yes or no question? And only then can we move on to a question of can we do blended finance? It could more often than not be the case that you can definitely do it, but definitely just thinking through those first two phases of like the decision making is quite important as we see. And I just want to address that first part of the why. And broadly, we see two big applications, and I'm going to keep it quite simple here, which was as we have thought through as well as we've done a lot of complex instruments, it's allowed us to take a step back and really question ourselves as to are we making it complex just for the sake of being complex, or are there simpler instruments out there? So we start out with these two different approaches to innovative finance. One is if there's a given amount of money, can we create more impact for the same amount of philanthropic dollars slash rupee that's spent? So which essentially means without really increasing the pile of cash at our hand, however big or small it may be, could we really be more efficient in generating impact out of this present pile of cash? So that's the first why that we had. And the second was essentially more related to the blended finance and less related to the innovative finance that Serena framed earlier, which was, could we also look at increasing or leveraging more capital into, say, development sectors and impact from the private sector for the given amount of philanthropic capital that we have? So those were essentially the two big ways that we framed this. And I think it's always easier to do number one before you move on to two. So more often than not, there's always the bias towards generating more capital, but then your funders are always going to be asking you the question of, am I getting the best bang for the buck for the money that I already have given? So we see these as two separate approaches, but also a step-by-step approach where you really solve for one and ensure that you're getting the maximum impact out of your current investments before moving on to bringing more capital in. So that's essentially how we are going to frame this entire discussion today. And I think just a simple point to make here as we move forward to the next page as well. There is still a big financing gap. You need to bring capital. And the one question to solve is what will bring it? And more often than not, when we bring the private sector, they still will think in terms of risk and return. And it's going to sit somewhere on that curve. And the reason why private capital hasn't come in could only be one of these two reasons. One is that the risk that is presently there in this particular challenge is not palatable enough for them. It's too high. The second is a return that they are getting currently is not high enough for them. So essentially, the only way you could make blended finance work is if there are reasonably enough returns or some kind of value generation that can come through the instrument. And secondly, if you could make the risk return palatable for the investors. I think the ICRC that we'll come to later has a very nice case of how the investor looked at these risks and sliced and diced it before even they did the investment. So there's a very philanthropic setting, but still I think there's a lot of the nuances of risk return that comes at play. And maybe I'll hand over to Serena, given she was the one who structured it all through the process as well.
Great, thanks, Prabhu. So starting, as you said, with the example of the ICRC, and maybe setting first the context for it. As you said, the context was quite challenging to think about a performance-based instrument for an institution that it's already seen as very cost-effective. And if you look at some of the rankings from about their value for money, they are seen as very high value for money for public donors to just give them a traditional grant. I think in order to understand the interest in impact bonds, you have to look at how they saw it as their primary strategy and mission to go beyond just looking at additional funding. So certainly there was a problem in terms of, for example, in the space that we decided to work in, physical rehabilitation, about the number of people that currently have access to mobility devices, which is between 5 and 15%. So there's definitely a funding need and a reason to seek additional funding. But the other reason was embedded. It is a cost-effective and efficient organization, but they wanted to take a leap into actually becoming a performance-based culture, which is quite different than just managing things efficiently. And then by doing that, they saw it as a strategic opportunity to also secure funding that was different from their core funding in a couple of ways. One that was additional, whether it came from the same donors by a different budget or by engaging new actors like investors. And the second thing that was very important for them when they thought about funding was different in nature. So, for example, different from the annual core funding that they would receive from donors that need to be renewed year on year, and that currently was not allowing them to actually consider longer term investments like what underpinned this impact bond, which was an IT system that would allow them to manage data and their performance better. So the focus on performance and linking actually the payment to the performance, and the interest in engaging private investors, particularly by shifting some of the operational risk from donors to private investors, all pointed to an impact bond. And the reason why we chose physical rehabilitation is that of all the programs of the ICRC, it was a program that had been set in place for a long period of time. And the organization had data, which I think is quite unique in the world of impact bonds, at least development impact bonds. They had data that covered multiple years and over 100 countries. So plenty of data for investors to scrutinize and do due diligence, but also a lot of track record for us to actually work out the operational and the financial model for the impact bond. So very briefly, just to introduce the concept of the impact bond, it is a set of contracts where, first of all, donors only pay for what they care for. So they don't give money upfront anymore based on inputs and outputs. They only pay based on the achievement of set outcomes, and their payment is correlated with the achievement of those outcomes. So the higher the number of people served and that regain mobility, the more money they're going to pay. So who upfronts the capital? In this case, it's the social investors, where they provide the capital and they assess and price the operational risk. And this is how we determine also the interest that would be paid by the donors to the investors in case of success. The ICRC is the service provider, but in this case also the performance manager. So they implement and they report on a frequent basis to both donors and investors. But ultimately the payment is made only when an evaluator, an independent evaluator, actually certifies the results based on the level of outcomes achieved. So that's briefly for the what the impact bond is. In terms of summarizing the terms, again, the most important feature was that the duration, 5 years, that allowed the ICRC to make investments upfront, build the hospitals, and then operate the hospitals for a couple of years. The amount, not large for the balance sheet of the ICRC, but very significant, probably still today the largest development impact bond in existence. And also the expected return of 7% IRR for the investors. And interestingly, this was not based not only based on what the market in terms of the investors would take, but also on our evaluation of the savings, in quote, generated by the improved performance of the ICRC in terms of more impact for money. And roughly half of those savings were translated into a 7% IRR. So basically they were shared between the donors and investors in the form of the financial returns. So we had a very nice narrative around the more impact for the same money, and then sharing, monetizing some of that impact and sharing it back with the investors. And ultimately the results were around the number of people served. Sorry, my mouse is, I'm not able to turn the pages anymore. Oops, I went too far. There you go. In terms of the number of people, the beneficiaries served that you can see on the right-hand side, both directly into the program that was financed, which was 3 physical rehabilitation hospitals in Africa, but also we estimated the positive spillover effects because the IT investment that was financed through the HIB will also serve the entire portfolio of the ICRC physical rehabilitation. And so as you can see, beyond what donors now can claim in terms of the impact that they may achieve, they will also help the ICRC achieve more impact across their portfolio. Prabhu, over to you for the next example.
Thanks, Serena. So we essentially looked at the International Committee of Red Cross, or the ICRC, as more an example of box 1, which was how do you increase the efficiency of pre-existing capital. So as you may have noted, there is private capital that is leveraged, but it doesn't really become more, as in the total pie of money doesn't become more, because if and when the outcomes are met, the donor still has to put in more than what the investor capital came in. So that essentially is why we look at some of these impact bond and results-based financing instruments as a way of increasing efficiency for the existing dollars rather than really leveraging and bringing in additional capital. So the only case where that could happen is if the outcomes are not met, but then that's not really a scenario where you want to be as well when you're looking to create impact. So that essentially was the example for bucket 1, which was increasing efficiency. We thought it would be a nice idea to not just speak about instruments that we structured, but also show some of the real successes externally. The one thing I realize is that both of these are from Africa. So it's good for some of our African friends who are here, but definitely for the next session, we will look to bring some examples from India as well. The medical credit fund was something we thought would prove as a nice case study for bucket 2, which is how do you leverage more private sector capital when you look at blended finance. And a small, say, qualifier there. So when we look at private capital, it could take multiple forms. It doesn't really have to be just institutional or financial capital. It could take the form of in-kind as well in terms of products and services. For example, you could have a volume guarantee that could bring more pharma drugs and vaccines at a lower cost. So that still is private capital because there is in-kind contribution. That minor aside, the medical credit fund essentially looked to solve a big problem in Africa, which is something to some extent we've crossed over in India, but say second level challenges still exist. With, say, the growing population and a growing focus on from donors, despite all of this, there was a big gap in terms of healthcare, which was more around affordable and high quality healthcare services across the continent. And quite similar to India and even similar to Southeast Asia, a big part of the healthcare is still taken care of by the private sector. And there was a big issue in terms of financing flows. So we have in the past looked at Kenya, Tanzania, and other countries. And there's one major gap when we speak to the private sector, private banks, which is that they don't really fully grasp healthcare. So they get collateralized businesses where they could get, say, finance a car, and if the payment doesn't happen, take it back. But health sector is something they haven't traditionally dabbled in. And because they do not have products and because there's a perceived risk as well, adequate financing hasn't flowed into healthcare. Of late, some of them have been dabbling in collateralized loan areas like, say, equipment, but that is truly a drop in the ocean. So what we wanted to showcase was these two financing challenges. One is on the hospital side, they couldn't raise adequate financing to really provide that higher quality of care, to expand and so on. And on the other side, with the banks, they weren't able to assess the risk and what were the returns they would get by investing in healthcare. And the Medical Credit Fund essentially looked to solve that by using blended capital. So on one hand, there were donors like USAID and the Bill and Melinda Gates Foundation that provided grant capital. There was also a low-cost debt that came from some institutional investors, including the CDC, IFC, and also Calvert. And on top of it, they also look to provide turn the grants into technical assistance. And lastly, by providing debt guarantees so that they could leverage private capital. And I think that part is the most important. So while you could have grants, technical assistance, the real big problem to solve for the Medical Credit Fund was not just providing debt over the lifetime of the fund, because it really isn't sustainable. The question they looked to solve was, how can I provide debt right now so that the local private banks will take over and provide the debt on an ongoing basis, even if the current fund has closed. So that was a sustainability quotient that they're looking to solve, which is where the fourth part of guarantees as well comes in. So to put it in perspective, they had a total fund size of 50 million, which had these 3 different buckets, grants and guarantees, which would be projected towards the local banks, and also direct provision of debt to these facilities. And the idea was that the fund would provide a guarantee and initiate discussions with local banks, together due diligence these hospitals, and provide loans over the long term together. This was the unlocking of debt from the local private sector. And so as we speak to them, we also know that it's been a slightly longer process than was originally intended. Bringing stakeholders together always takes that time, but unless you bring the local financial sector into the equation, it is never going to be sustainable. So that's essentially the reason why they looked at guarantees as a mechanism for unlocking that capital. And on top of which, they provided their own in-house capital to the tune of 41.5 million, which went as debt. And the last important component was around technical assistance. So given your goal is essentially towards increasing quality, the technical assistance was deployed towards multiple areas, starting with even designing the hospital, because a lot of these are entrepreneurs who haven't really built a hospital. So sometimes they build a hotel instead of a hospital. So there was hand-holding to start off with. And then as you move on, providing them technical assistance to build the right quality measures. How do you certify the healthcare professionals? How do you train them on some of these basic healthcare services and so on? So right now the fund is definitely been successful when looking in retrospect, but it's been a series of ongoing developments and modifications as we have seen outside and that they have had to do. And in terms of impact, just the numbers would definitely speak for it. So they've been able to deploy capital to the tune of 50 million, but also provide about 3,000 loans within this, and involved a healthcare. Sorry, I think the slide is going a bit forward and backward. Yeah. And looking at returns which are 4 to 5%. So at the outset, it may not look like a lot, but essentially this is why the return, I wanted to spend a bit of time on the return as well, the return on assets, where there is a blend, where there are donors who said they are fine with zero interest or even no return capital, while there were institutional investors who wanted a higher return. And by blending both of these, you are able to reach a risk return size that not only is amenable for the healthcare providers, but also brings an additional banking capital, which will be at a higher rate. So it's essentially blending these different capitals of different risk structures and different return structures to arrive at the final solution that was quite elegant with this. Yeah, and just to move forward on this, we just thought we'll spend a bit of time on the third aspect of our discussion today, which was around what all capital is possible. And I'm going to keep it a bit brief in the interest of time. But starting off, you could look at it as a spectrum from the left to the right. On the left hand, there is traditional assistance, which comes in the form of grants. And it moves all the way to the right where it's commercial investing, with those two big buckets in the middle that we spoke about. Conditional funding, where you could look at the ICRC as a example for conditional funding. And with respect to catalytic funding, the medical credit fund serves as a nice example, just to show that you don't need to be at either end of the spectrum, but there's a nice, really viable segment in the middle, and characterized by both of these case studies we spoke about today. I'm just going to quickly move on to the next page as well and take you through what the spectrum could mean. So as you see, grants are potentially the starting point for any philanthropic donor, where there is still a big need for traditional grant capital, where there is no return possible, and which means there is potentially no blended finance instrument that could be devised. So it still makes sense to retain the philanthropic structure as is. Having said that, there are still slightly innovative ways by which you could bring additional capital. For example, co-pays, where for every dollar of the donor's contribution, there is additional contribution that could come from, say, the private sector or other donors, or even the recipients as well. The simplest case in point could be that the donor puts in $1, and say the training institute that benefits by placing the recipient also puts in the dollar, or even it's the recipient itself who contributes that. So it becomes a co-pay model where you could, for every dollar, bring in additional capital. Moving on, there could be different forms of conditional funding. The more complex instrument that we spoke about, where, say, the impact bonds, which you see in the middle, where you not only bring in different donors, but also make them pay only for success. But like we mentioned earlier, they make a lot of sense when there is a risk transfer that is needed, but they also tend to be more time consuming. So there could be simpler structures you may look at, including interest buy downs, where there are great examples in India as well, NGOs like Shram Bharati, which are lending out for TB loans. And based on the outcomes met, there could be the donor could pay or bring down the interest rate for the recipient. So essentially the donor gets what they want, which is A, conserving their capital, but also B, forcing outcomes to be met by the entire system. And the recipient as well gets what they want, which is they may not be able to take such high interest loans, but at this level, it all makes financial sense for them. The last could be, say, performance-based contracts as well. And just taking a step back once again from impact bonds, it is great to measure outcomes, great to pay out based on them. But like I said, they also tend to be complex. And if you don't really need to make it complex, you could still look at tying the outcome, the payment to outputs, or in some cases, even inputs, as long as that attribution to outcomes exists, and as long as the cost of measurement is controllable. So there is still place for even performance-based contracts as a follow-up mechanism to some of these complex structures. We once again spoke about catalytic funding with respect to the medical credit fund, where there could be financial guarantees, where, say, in order to unlock private capital, you de-risk the investment for a private provider by providing a guarantee. Even in India, this has been the most common form of innovative financing so far. The other way, particularly for bigger donors, has been looking at volume guarantees, where you force vaccine and pharma providers to essentially drop their prices in return for a high volume that is guaranteed. And the Bill and Melinda Gates has done it successfully in the area of vaccines for Africa over the last decade. And lastly, the area of commercial investing, which essentially sits at the other end of the spectrum as opposed to traditional assistance, where you could have market-based loans or even sub-market loans, which are collateralized or non-collateralized. And so I think the only area you would need to do this if despite your guarantees, there is no flow of capital, you may want to take up the burden yourself, as was characterized by the Medical Credit Fund. So part of their guarantees was lying in the catalytic funding space, but their direct debt was more in the space where they provided concessional loans as well directly. And there's a definite role for, say, mixing and matching these catalytic funding and commercial investing so that the right amount of capital flows in as well. So that essentially is a quick range of instruments, and we're going to speak about it going forward, but I just want to show that there's a range of tools available, and you may have to pick and choose as to what is your funding need, what's the problem you're solving, and there could be multiple combinations that are possible even within these 10 to 15 instruments that we showed. I think there's just one last example of, say, these loans that I wanted to pick up, which was what we saw in Tanzania, where donors were willing to pay or provide loans for skilling medical students and nurses in return for, say, higher access. And they would pay back these loans as they went through their medical curriculum, started working, and paid back to the donors. So traditionally, you wouldn't have banks lending to such sectors because inherently there's nothing to collateralize. So you would still have a market return, but this is in an area where traditional banks wouldn't engage. So just wanted to close off with that example and hand over to Serena to pick up some of the myths around innovative financing.
Thanks, Prabhu. And I think in the interest of time, I'm going to try and be a little bit quicker about this, but they always make for good provocative thoughts for discussion. So the first myth is the curse of popularity. A lot of these instruments tend to be quite, particularly the shiniest and newest ones, tend to get a lot of attraction. And with it, also some criticisms. Lately, impact bonds, but even just to put things in perspective, in 2010, when the Gavi Advanced Market Commitment was launched, and it was very successful in terms of its size and its impact, it was also criticized for how long it took and how costly it was to design. So the overall impression is that innovating finance is expensive and time-consuming. And but as we said before, innovating finance is not financial innovation, so it doesn't have necessarily to come at this high cost. And it is, as you said, Prabhu, a menu of instruments that also include some very simple instruments that are actually quite easy, very well known, have a long track record, and are easier to structure. Sorry, I don't know if someone can turn, oh, I got the pages back. Sorry. The second myth where we spent quite a bit of time is that innovating finance is a jargon. As you learned today, it is a language on its own. And partly it's a jargon also due to consultants like myself helping donors and investors trying to reframe the language. But as you've seen today, there's a lot that goes beyond that jargon. Once you speak the language, it does come down to the basics of some traditional and only a few more innovative financial structures that actually have been in the market for a very long time that investors can recognize and invest in. And public money has played a role in scaling the application of some of these traditional mechanisms into the development space, and you're all familiar with many of them. So strip the language, we're talking about, for example, the rise of impact investments on the heels of private equity and the growth of investments in emerging markets, which is now considered a more popular and traditional asset. Microfinance and also the role that public capital has played in sectors like agriculture first and renewable energy more lately. And yet a lot remains to be done in some of the underfunded sectors like water or gender empowerment. Last but not least, maybe final shout out that Innovating Finance is not just impact bonds, although, as I said, usually the most popular and shiniest and newest product takes the stage. There's more to it. Having said that, we still are approached by donors and corporates trying to explore the application of impact bonds within their programmatic areas. And as great that these products are, and we love to design and structure them, they're not the only tool. And so our approach, and Prabhu may talk about this a little bit again, is to actually look at the instrument and weigh very early on in the stages of design its pros and cons. For example, impact bonds, as I mentioned in the ICSC, are very good when there is a material operational risk that can be transferred to investors and can be priced. So when there are savings that are generated that can actually justify the payment of the return. In other cases, and as we explore the feasibility of impact bonds, we do leave the door open to look at simpler instruments like performance-based grants that might just do the job. So always be open to other solutions as they come, and try to explore very early on what is the most relevant menu of instruments that might apply to a specific situation. Maybe over to you, Prabhu, for some final lessons learned from our work.
Yeah, sure. I just want to pick up the last point that you spoke about, Serena, about impact bonds, and really tease out how we look at the process as well. It's always good to start with the problem and step by step move on to the solution, rather than jumping in with the solution itself, which essentially inverts the entire process. So you could still start out with what the healthcare problem is, what are the financing challenges, and end up with a medical credit fund and not with an impact bond. And that's why it's always very important to start off with a case of, say, problem, and then slowly moving towards a solution, rather than the other way. So that is one point number one that I had in mind. And the second also was around a lot of initiatives or a lot of funding looking to solve the same problem but in silos. And one thing we've learned from some of the biggest donors is to look at the problem at an ecosystem level, or looking to create multi-stakeholder environments where it's not a question of you solving it alone, but looking to bring different donors so that there's a go-funding mechanism, or looking to bring local donors so that there was a sustainability element, or even the government. And last but not lastly, even the private sector to fill in that space and ensure sustainability. And a key thing, I think there's been also a lot of learning that has happened over the last decade, where specifically in Africa, there were parallel health systems that were created separately from the government. And a lot of donors were creating very parallel health systems in each country. But now, realizing the huge wastage that has happened, there's all coalescing towards these multi-stakeholder approaches as we go forward. The third point I wanted to note was, while we spoke a lot about innovative financing and so on, there is still a need for traditional philanthropy to exist. Like we said pretty early on, there are a lot of problems you could solve through market-based instruments. There are a lot of problems which you could use blended finance to solve. But there are problems where there is no financial model that exists for a reason, because it can only be solved through philanthropy, which is why it's, as our donors move forward as well, they have kept a good portion of their funding still locked in philanthropy to solve those big challenges that only donor and donor capital can solve. So that marks the end of the material that we had wanted to discuss with you on. Maybe I want to leave it to Kavita to say, look at some of the questions and channel it back to us.
Yeah, thank you. We have some questions, and I can also see some hands raised. I request the attendees to kindly type out the questions so that I can see them, because we won't be able to take in questions with the raised hands. So the first question is, for the ICR, were there qualitative indicators? Sorry, can you hear me?
Kavita, is this for the ICRC?
Yeah. It's from for the ICRC. Did we have qualitative indicators?
No. So in the case of the ICRC, well, we had quantitative indicators, but trying to capture quality. And happy to take this as a separate discussion with the person who's interested in learning more or sending materials. But we came up with an indicator that was simple, but was a composite of indicators that captured both the efficiency of the intervention as well as some of the quality of the services. For example, we looked at drivers of efficiency such as floor space dedicated to the facility, as well as the proximity of some of the different rooms and equipment in order to optimize interventions. So there was quality captured, but still as a function of efficiency. And it's probably one of the few development impact bonds that has one indicator. A lot of other impact bonds do have multiple indicators, also with the purpose of separating more quantitative indicators like access from quality indicators like choices. But in this case, we felt that we could come up with, summarize it in one indicator, and that was actually quite attractive for investors in its simplicity.
The next question is, would it be correct to assume that grant or concessional funding is the most critical capital in making innovative financing work?
Yes, I would agree with that.
Yeah, I think great question. And just reflecting back on how innovative finance is developed, there's been a move towards taking grants into, say, for-profit or low-return capital. And we still see that the big bottleneck in, say, placing and getting through a lot of these innovative finance applications is philanthropic funding. So a great question, and quite agree with this, Sven.
The next question is, how does a nonprofit identify which of their programs are suited for innovative finance?
So I'm going to start speaking through it and then leave it over to Serena. But we typically look at start off with the status quo, where we look at two big things. One is, what are the current set of interventions that the not-for-profit is currently undertaking? And secondly, what are the current sources of funding as well? And a mix of these two essentially gives you a sense of how much of these how much more efficiency could you derive from this particular same set of interventions? What additional interventions could I add to the existing set so that I could make it more efficient? And if that's the case, what additional funding do I need in order to get there? And then it becomes a question of finding the right sources of capital that could supplement your existing work so that it scales up, or complement your existing set of interventions through additional interventions. So I think the last point I also wanted to add was the level of data. A bit of it Serena touched upon earlier, but even for the not-for-profit world, the level of evidence and data is becoming more and more important, and donors have started looking at paying for success or linking their payments to outcomes, so that they don't really have to worry about how many screening camps the not-for-profit ran and how many people they're employing and what are their operating costs. So given that model, it's become quite important for not-for-profits as well to assess what are the current level of data and evidence that they've generated for their interventions, and how much can they link it to the outcomes that their donors desire. I just want to also leave it to Serena to speak more.
Yeah, maybe I'll add just very quickly that I think innovating finance via menu of instruments is really suitable for interventions that are both revenue generating and non-revenue generating. And I'll give you an example. We have applied impact bonds in the space of not-for-profits because they do tend to be grant-based with the working capital used, and the service provider doesn't have to repay. However, we also apply them in the case of a social enterprise that is not yet to break even, and the impact bond gives them time to access concessional financing while, in quote, figuring out the revenue model. So again, both not-for-profit, but also for a small proportion could be early stage social businesses. While again, there's a new life to, or a similar instrument to impact bonds, which is called social success notes, which are loans where the interest rate is linked to impact, but they could be applied to more mature social businesses, but it still has some of the nice features of impact bonds. So again, the instrument fits the underlying business, and as a result, I think Innovating Finance, at least as a toolkit, can address challenges, both not-for-profit as well as in for-profit enterprises.
Okay, the next question is, are there ideal fund sizes for using blended finance tools?
Yes and no. When we design and structure instruments, we're trying to look at cost efficiencies. So we hope in the case of impact bonds, for example, nothing less than 10 million. In case of funds, nothing less than 50 million. However, we all know that if the application is quite difficult, often a way to start is through pilots. The proportion obviously is that they tend to be less cost effective, but in some cases you do want to consider smaller ticket sizes as a way to test and then scale the model before launching something. And this is the case for other proven models that are applied to a new environment or for more innovating financing models.
The next question is, currently the pipeline of non-profits that are DIB ready is very small. What can existing market intermediaries do to ensure we have more non-profits ready to take up DIB or SIB?
That's a great question. I think we actually even came up with a new jargon, which is how we can make service providers more dibbable. So I think there are a couple of things. One is that it's an evolving market, and the biggest constraint right now has been the ability to secure outcome funds. So it's one of the things where as more money becomes available, and there are currently some donors talking about coordinating funding, and local governments considering starting to commission outcomes as money starts sort of like being present in this market, there will be increased activities from service providers to get ready for it. On the other side, there's the importance of technical assistance as part of capacity building of service providers. In every product we design, we consider the process of structuring, and we try to also dedicate time and resources to work with service providers, particularly on their, obviously on their monitoring and evaluation and on their management systems, to help them strengthen. So often that process starts with the design of an impact bond, but also requires additional resources, both from the service providers, potentially from donors, to help them in that journey.
The next question is, based on the significance of grants in innovative finance, how do we embrace innovative financing in places where philanthropic grant is scarce?
So I'll take a first stab at the question, maybe. So intervention number one that we've seen work quite well is if there is scarce grant capital, looking at what are, say, challenges that are stopping donor capital from going in there. So it could be that there is not enough thematic capital flowing to that area. For example, given a lot of the donors are looking at maternal and child health, and you are in the space of, say, ear care, there is not going to be enough capital, and there's not much you could do about it. The second, the more pertinent to your question, is where you have a model where capital is scarce, donors do not exist, but there is a great need. So at a long term, you could look at, say, building the evidence so that, for example, the area of mental health, as we know, as an area where capital doesn't currently exist, but there is donor movement that we anticipate going that way. So you could still look at a long-term view, start generating your evidence so that you are at the right place at the right time when such capital flows into that area. So that is what I would suggest, more looking from a long-term view. In the short and the medium term, it will essentially have to be these other two areas, such as how do I become more efficient with the existing and scarce donor capital, and also how do I supplement my model, already efficient model, with other forms or other sources of capital to make it more even more sustainable. Some models that we've seen work in the absence of donor capital are cross subsidization, where you build a model that's around uh, having variable pricing points, and where there is a real demand for this particular service, and you charge the people who could afford more at a higher price point, and then use that to supplement your costs, or even provide it for free when you're catering to the lower income and less affordable populations. And this all is predicated upon building a model that is designed towards affordability, but also high quality of care, because you're essentially attracting two completely different demographics here.
So in the interest of time, we'll not be able to take up all the questions that are still left unanswered, but I have some very interesting news for all of you who have logged in. As I had mentioned earlier, this is a 3-part series, and we'll be doing the next webinar on the 27th of February. So if you have any questions that have not been answered yet, or if you have some more new questions that have come up later, or if there's any specific information you're looking for that is related to this topic, please feel free to let us know at india@avpn.asia. I'll be reaching out to all of you with all the details regarding the next webinar, and I request you to participate in that in case you are still interested in finding out more about innovative finance. So thank you everyone for your participation in this interesting session. Thank you very much, Prabhu and Serena. And we will post, some of you have asked about the recording. We'll be actually posting the webinar recording on our website by next week. So please look out for it. The AVPN Conference 2020 is being held at Singapore from 9th to 12th June. We'll be having such innovative and interesting sessions in the conference. The theme of the conference is the power of networks. We'll be covering many interesting discussions regarding social funding and investment in Asia. The registration is now open. So please visit conference.avpn.asia and register. And have a good day, everyone, and look forward to meeting you again on the 27th of February. Thank you so much for joining.
Thank you.